Hello, welcome everyone. I'm Jessica Reed, the VP of Strategy and Global Partnerships at RapidSOS, and thank you all for joining us. Thanks for taking the time to be a part of Ready23. For those of you who may not be aware, Ready23 is hosted by RapidSOS. RapidSOS is an intelligent safety platform that securely links life-saving data into monitoring centers, 911, as well as first responders during emergencies. Ready23 is an opportunity for all of the key stakeholders involved in emergency response to come together. It gives us an opportunity to connect, talk about innovation and how we can continue to drive emergency response forward. Today, we are joined by two industry experts from business as well as public safety. We have Hayes Bailey. He is the founder and CEO of Sheqsy by Safety Culture. He is joining us from Sydney, Australia. And we have Andrew Dameron, who is the Director of Emergency Communications at Denver 911. And that kind of gives away where he is dialing in from today. So I want to hand it over to our panelists to introduce themselves properly. Guys, if you can give a quick overview of who you are, and importantly, what are you doing here today talking about emergency response? Hayes, let's start with you, and then we'll pass over to Andrew.
Perfect. Thanks, Jess. Appreciate you having me today. My journey started 7 or 8 years ago. I was selling vehicle tracking and telematics, and a common question that would come up from customers was, where are my employees when they're not in their vehicles, and are they safe? And so at the time, I started developing the Sheqsy solution. It was to have a simple and cost-effective application that could be deployed on smartphones for businesses to ensure the safety of their employees. And sort of fast forward 6 or 7 years, it's used by tens of thousands of workers across about 25 countries, but obviously the US and Canada as well.
And also my thanks for the opportunity to chat with the two of you today. Andrew Dameron, Director of Denver 911. I've been here for about 3 years, started my career with the Department of Homeland Security, worked in the private sector for a few years, actually within healthcare, where we struggled with this question of when we've got lone workers who are out at various hospitals around the country, how do we track their productivity, the work that they're doing? So this is a challenge that I'm excited to hear more about what Sheqsy is doing. As far as kind of why I'm here today, emergency response is what we do in 911. And I think one of the most important elements of my job and any leader in the public safety telecommunications space is to have these kind of collaborative conversations with technology innovators in the vendor space who can help us continue to move the ball forward when it comes to how we support our residents and constituents.
Well, thank you both. For those of you who are joining us, this discussion is going to center around lone worker safety and how companies are connecting their lone worker safety solutions to safety agents and 911 during emergencies faster than they've ever done before. So as you all are aware, this is a virtual event platform we're using. Please feel free to participate. We'd love to see your questions coming through, so please do engage. We're going to run through a few questions now, and then we'll certainly make time for any questions that come up throughout the panel. Okay, Hayes, we are going to start with you. We'd love to hear from you on what changes you've seen over the past 5 years in the realm of lone worker safety, and importantly, how companies are thinking about keeping their lone workers safe.
Yeah, perfect. Thanks, Jess. I think in the last 5 years, I talked about, affordability and accessibility before, but we've really seen businesses that would be purchasing physical duress alarms and additional hardware start to move more to solutions that are smartphone and app-based in areas where it makes sense. Obviously, when you purchase a physical duress alarm, there was always that cost of the piece of hardware, the SIM card, the employee needing to remember to carry that device with them and to charge it and all those sorts of things. Obviously, the smartphone these days is essentially attached to everybody. Most businesses are deploying them to their staff. And so being able to have an application sitting on that they can activate at any point if they need assistance, but also providing visibility back to that organization of where they are has been quite beneficial. Obviously, you can always have, Bluetooth buttons and other inexpensive periphery items that you can then attach to that smartphone. But then we've also seen in countries like Australia and New Zealand, legislation start to come in around workplace health and safety, but actually calling out lone workers and the obligations that those businesses in those areas have to understand the hazards and risks faced by their lone workers and actually do something to mitigate those hazards and risks. If later on they're found not to have done anything or taken any reasonable steps, directors and officers of those businesses can be held liable. So that's a key driver, and a couple other pieces would really be that Facebook, Instagram, all these applications, dating apps, people share their location information. And I think in the last 5 years, we've seen just the general public become a lot more accepting of their location information being collected and shared. And so the idea of having something on your phone that allows the organization to know where you are and know that you're safe is not as frowned upon as it may have been in the past. And equally, we've gone through a period with the pandemic and obviously a lot more people working remotely and their direct managers maybe not being in the room with them and needing to have access over where they are. And then obviously more recently, there's a little bit, of civil unrest and, rising interest rates and cost of living pressures. And they obviously drive, situations in society where this sort of technology may be used. So there's a lot of factors there, I suppose, in the last 5 years, but it's definitely moving at a rate of knots.
And yeah, I mean, on the back of that, Andrew, from your perspective, like, how would you describe what you have seen over the past few years with collaborations like this with Sheqsy and others? How is that changing the way that you and your team are working?
Well, we are very blessed in public safety to have such a robust cadre of technologists out there who are creating tools and resources that are, meant to help people. Whether it's a lone worker safety issue or whether it's conveying better location information to 911, more comprehensive information about medical or mental health needs to any first responder who may be arriving on scene. These are all things that, we're, as an industry, I think, responding to needs that we've identified. And in the public sector, we don't have the bandwidth or the subject matter expertise or the education or training to develop the tools that we need to serve our residents best. And so partnerships with companies who are kind of building these tools and, whether it's kind of piloting new functionality or creating a brand new, space for tools to be utilized within public safety, it's all kind of moving us forward toward kind of a better operating environment where my folks at 911 can support our residents, anybody who calls us for help, better, more efficiently, more quickly, and ensure they get the best response possible.
Fantastic. Hayes, I'd love to hear a bit from you, in your experience and what you're seeing with these large corporations. They're fighting to keep their lone workers. It's a competitive market out there. To what extent are you seeing employee safety factor into assessments of these large employers as lone workers, have have the opportunity to pick and choose. In particular, love to hear about how our technology, our partnership plays into your tech solutions, engaging with these organizations that are like fighting to maintain these employees.
Yeah, I think obviously all the time we've got more corporate and social responsibility that these businesses are taking on and having to report to stakeholders and to public markets and people like that around lost time injuries and impacts on their workers. And we've got more and more situations where it's, you know, psychosocial outcomes for people that have been stressed at work and those sorts of things. And so all the risks that are faced by workers when they're working alone contribute to this sort of stuff. In terms of the legislation in the US, I suppose, for corporations, there's nothing that actually specifically cites lone workers, but there is the general duties clause. And so, you know, in circumstances where they failed to have a policy around lone workers, and it could be considered a general duty breach within the OSHA legislation. So I think for a lot of businesses, there's more and more visibility over that. And people within those organizations, you know, actually putting time and effort in to be aware of the risks. From a worker perspective, workers can be a lot happier and know that they're being cared for, and there's, you know, obviously gives them, you know, the support and the want to be at those organizations. And in the past where you were sent off to do a job and you left at 8 a.m. and it was kind of hoped that you'd be back by 5 p.m. and there was no visibility over where you were, whether you were safe, if you had 8 home visits, to what Andrew mentioned before, throughout the day, you know, whether you hadn't turned up at the 4th one and nobody knew. And so I think once workers have an understanding that someone cares for them and someone understands whether they've left that 3rd appointment, made it to the 4th appointment, and that if they need any assistance at any point in time, they're able to press a button or, you know, have an alert raised automatically based off timing and those sorts of things. And yeah, it's incredibly important for those organizations.
Yeah, absolutely. Are there any specific you know, testimonials, feedback that you've received that you can share with us?
Yeah, I think without going into sort of actual specific organizations, I mean, in the healthcare and community services space, we deal a lot. The higher risk healthcare and community services are your alcohol and other drugs, your family violence prevention, and some of those, you know, family unit services. And we have had many instances where workers will go into these situations. There'll be people there that they weren't aware were going to be there, and they'll feel unsafe or be in a situation where they have to put themselves out of harm's way, and they need to discreetly activate and let somebody know that they require assistance. And so in those situations, being able to give them an application or a button that they can trigger, which is going to go through using obviously RapidSOS's services through to first responders to be able to send people out. That's incredibly important. We not only see those situations, but then obviously we see situations where people are out working alone. We've had situations, particularly in Australia, and no different in the US. You have hot, dry environments. You have workers working for local government or working for mining companies, and they're out there and they have a vehicle breakdown. And again, you know, being able to use a device connected to satellites that they can trigger a duress alarm on to be able to get assistance and share their location where they might not have had any cellular service. And in the past may have had to walk for hours at a time to get assistance. So we've had many of those sort of situations.
Yeah, it sounds like quite a diverse range of situations that you've really been able to make a difference in. Andrew, over to you. It'd be great to hear from you about how you've been using RapidSOS, how you and your team has been able to incorporate this type of data that Hayes and other such companies have been able to use, and to send over to you. How have you been using it? What type of impact has it had on your community?
Well, actually, a very specific example to Denver, through our STAR program, where here in 911, we're dispatching clinicians to certain 911 calls as opposed to police or an ambulance. One of the challenges that we struggled with early on were our police dispatchers who have been dispatching police to these call types for some of them, close to 2 decades. And the thought of now all of a sudden switching to sending unarmed civilians to calls that always got an armed police response was very difficult. And it involved a fairly significant culture shift within the way we do things. And one of the things that was helpful in having that conversation is we had a licensed clinical social worker who was the program manager here within 911, who was able to kind of talk to the dispatchers and say, listen, guys, community mental health workers do this all day, every day. They're going out in their personal vehicle to people's homes, going into their living rooms, sitting down and chatting with them. As a part of the STAR program, we're way safer. We've got a radio. We've got a paramedic with us. We can call for help. We have you keeping track of where we are, through the CAD system. This is way safer than work that, people like me are doing. And I'm speaking for her, not me personally, but, community mental health workers are doing in the community all the time. And that was very helpful for our dispatchers to kind of shift their mindset. But at the same time, it highlighted the fact that, well, we've got a lot of community mental health workers who are driving their personal vehicles to people's houses and nobody's keeping track of where they are. So that, I don't know if it was directly related to that, but it did spark some conversation with our local mental health partners about, okay, maybe we ought to start looking for a tool. And they actually reached out to me and said, hey, what should we use? We need something that will allow us to get a hold of help if we need it, where we can track our lone workers and all of that. And I did what I always do when I have somebody come to me with a question like that, is I pointed them to RapidSOS. And I said, look, and this kind of goes to your question. We utilize RapidSOS every day. It serves that point, like what I was saying earlier, we've got this amazing group of vendor partners who are coming up with these fantastic tools. But if it were up to us to find a way to ingest all of these separate data points, there's no way we could do it. We would just say, you know what, pick up a phone and call 911. That's how you can tell us what's going on. So through a partnership with RapidSOS, we can rely on your subject matter expertise to take information from Sheqsy, from Uber, from all of these different sites, bring it together and bring it to 911 in a way that's ingestible and actionable. And so I know our community mental health partners are currently working through that process, but it's been done in a way that will allow us to be a valuable partner without relying on the 911 operators to also be monitoring some sort of additional third-party software. And I do the same thing anytime, being the largest PSAP in the state of Colorado, we do get approached from time to time with kind of entrepreneurs and technology vendors who have a cool thing that they want to try out. And every time I say, you know what, go talk to RapidSOS first, because if you want us to receive your data, then that's how we're going to do it.
Thank you, Andrew. Hayes, back to you. How can other organizations draw inspiration from the work that RapidSOS and Sheqsy have done together? What advice or insights would you offer companies that ultimately are looking to provide a safer experience, greater well-being for their end customers?
Yeah, I think Andrew made a good point there about ingesting the data into the PSAP and making it sort of standardized for the workers. I mean, one of the great things for us, our application, you can set up SMS alerts, email alerts, those sorts of things. Organizations can choose to monitor themselves in many countries, but by working with RapidSOS, we were able to standardize the integration into the RapidSOS system. We then know that with your integrations with the PSAPs, that there's going to be standardized information going to them. And then from our perspective, it's meant that we can access first responders in Canada, and we've now been able to expand to first responders in the UK. And it all uses the same endpoint from RapidSOS, the same endpoint from us. And so there's no additional integration that needs to be done. Once the PSAPs, if you like, in all those regions are set up with the RapidSOS software, we're then able to access it. So, I mean, that's probably been by far the best thing about this relationship, where in the past we'd go to New Zealand, we'd go to Australia, we'd go to these other countries. We have to go do a different integration with every different monitoring partner and every different first responder organisation that we want to work with. And so by working with RapidSOS, we've been able to alleviate that.
Fantastic. Well, now we're going to transition a little bit from now into the future. And just before we do that, for those of you that are tuned in, now is the time to send over any questions. We've gotten a few already, but we'll be turning to them just after we've covered this particular one. So this is for both of you. Would love you to think about how you envision the evolution of emergency response over, say, the next decade or so, particularly as it relates to lone workers. Whoever wants to start.
I mean, I can jump in from a technology standpoint, I guess, and from the frontline worker perspective. I think that lone worker safety and solutions to support keeping workers safe is something that will actually be more broadly added to business applications. I think, you know, recently with the latest issues of or releases of iOS devices and the latest releases of Samsung devices and different pieces of hardware, there's obviously consumer focused duress functionality where people can, you know, tap their power button and trigger you know, a first responder and those sorts of things. So obviously they're really consumer focused solutions, and there'll always be a place for a business appropriate solution where the organization also gets visibility of their workers and what they're doing. But I think as location sharings become more acceptable, I wouldn't be surprised down the track if other applications, even Microsoft Teams or different things like that, start to have some sort of lone worker safety component to them, and it's just readily available to all workers.
And from my perspective, I think the evolution, I mean, not to just land on a buzzword, but I think the leveraging of AI and creating more automation. 911 is continuing to be asked to, again, ingest a lot of this stuff, and it will be crucial, I think, to have tools that allow us to automate that ingestion, create something that is a little more distilled for our call takers and our dispatchers in order to leverage the various pieces that are out there. You know, conversations around the various data points that are available that we can't leverage today. If we had robust AI tools that could actually distill that information into something that makes sense to a 911 call taker or dispatcher, I think that will certainly, it just creates economies of scale when it comes to the various resources that are out there that we can begin leveraging more effectively.
Excellent. Well, yeah, exciting times. Let's see what happens. I'm going to transition over to some questions that we've received. The first one here is one of the attendees is curious as to whether or not you've looked at programs for lone 911 workers and how that would work, since they're the person that would be called. So yeah, what if 911 needs help? Thoughts, ideas? Hayes, looking at you. Andrew, love your feedback on this too.
I wouldn't be surprised if there's some sort of fixed duress or some sort of alarms within the operating centers, but it's probably one for you to pick up there, Andrew.
Sure. Well, with the exception of a small handful of PSAPs in the United States, we haven't figured out the remote work piece just yet when it comes to 911. Now, at least here in Denver, we do have a team of non-emergency call takers who answer our non-emergency line, and they do that from home. They are remote workers. Matter of fact, we've got a couple who live outside of the state of Colorado doing that work. And actually, that's the utilization of some sort of lone worker tool is not something that I had thought of until that person asked that question. So I appreciate the question. We're able to maintain pretty consistent contact with those individuals just by the nature of the phone telephony technology that they're utilizing. We kind of know their status at any given time. However, we don't have eyes on them like we do with the folks that are here at the primary center. So, all right, you've given me something to think about.
That's what this is all about.
Yes.
Excellent. The final question that I think we've got time for today is for you, Andrew, and it's about, okay, you've got this additional situational awareness data coming into your ECC. How do you train telecommunicators on how to incorporate this data into their SOPs? And as new data types are coming through, how do you continue that process? And what words of advice do you have for others?
Well, going back to the work that RapidSOS has already done on the front end, that simplifies things for us significantly. So when the SOP simply states check RapidSOS and look through, we can train them on the type of information they can expect to see. But from there, it's pretty self-explanatory. If it were, again, go to this application on this screen and check for, which I will say, even with RapidSOS, we still have some legacy systems that require us to do that. So, we do have our call takers have to go to one system to check for this piece of information, a different system to check for this piece of information. And so that's where that aggregation becomes so important. If we can get as close to a single pane of glass as possible for our 911 operators, that make things much easier. And then their inherent skill as the first responders, they know what that information means when they receive it. It's just a matter of providing it to them in different ways, in a way that is easy to utilize in that moment.
Well, thank you. We're about at time here. So Andrew, Hayes, thank you both so much for taking the time to be a part of this panel. Thanks for your generosity in providing these insights. And yeah, we're so grateful to have you as part of the RapidSOS Ready community. So thanks so much. If any of you that have joined would like to connect, ask further questions, please don't hesitate to reach out to me. I can be reached via email at jreed@rapidsos.com, or you can connect with me on LinkedIn. So we have a lot more sessions lined up, all very engaging stuff, huge variety of subject matter today as well as tomorrow. So please check out the WOVA platform for more information on those. And thank you all so much for being a part of today's event. See you later.
Thank you.